Good afternoon. This is the Thurston County Board of Health for October 10th, 2017. I'm Commissioner Bud Blake, the chair of the Board of Health this year, and I'd like to start off by doing introductions. To my left is Commissioner Gary Edwards. To my right is Commissioner John Hutchings. To his right is Lydia Hodgkinson, the clerk of the board. And to her right is Shelley Slaughter, the Director of Public Health and Social Services. And to her right is Dr. Rachel Wood, the Health Officer for Thurston and Lewis County. And to her right is the County Manager, Ramiro Chavez. With that in mind, I'd like to ask the motion for approving today's agenda.
Chair, I move to approve the agenda for today's BOH meeting, October 10, 2017.
Second.
It's been moved and second. Stated, all those in favor say aye.
Aye.
Aye, and that motion passes. Okay, so the next item we have is some proclamations. We have two proclamations today, and first off, we're going to start off with the breast cancer awareness. And as you can imagine, if you don't see it on the camera, you see it on our shirts or our ties. This crazy tie this guy's wearing and his collar stands for awareness for breast cancer. And we've asked members of the American Breast Cancer Society here in Thurston County to come and receive a proclamation and tell some stories that how some survivors, not only themselves, but the families, the community as a whole, and we're super excited about that. And so with that in mind, I asked Shelley Slaughter, the director, to frame it for us, and then I'll bring some people to the podium.
Good afternoon. It's so wonderful to see such an amazing audience here today for two very important causes. October is both Breast Cancer Awareness Month and Domestic Violence Awareness Month. So thank you to all of you for being here. Breast cancer is a very serious public health issue. According to the CDC, other than skin cancer, breast cancer is the most common cancer for women, and in Thurston County, it is the most common. So very important. Breast cancer can be prevented, as many of you know, and getting mammograms regularly can lower the risk of dying from breast cancer. The United States Preventive Services Task Force recommends that if you're 50 to 74 years old, you should be sure to have a mammogram every 2 years, and if you're 40 to 49, you should talk to your doctor about how often. I myself am having my first mammogram this month. So I encourage you all to do that if you have not done that yourselves, and also to do regularly breast self-exams. So I'm sure our experts here in the audience may have more to add about that. But I'm just so thrilled that we're here to honor the survivors of breast cancer and their loved ones in our community, and all of those of you that work to help prevent and treat breast cancer here in Thurston County. So with that being said, we have an amazing group of men and women in this room today who I'd like to invite to come up to the podium to receive the proclamation from the commissioners. And so I'd like to introduce our guests, Kyle Kronk from YMCA, to please come to the podium. Carrie Trout, who's a certified breast patient navigator at Providence St. Peter Hospital. Corinne Wool, who's the business development representative for Twin Star, and Nicole Woosley from the American Cancer Society.
I don't know which one of y'all want to grab the mic first, but we'll go with the American Cancer Society. Is that all right? And then we'll take turns in terms of speaking, and anybody else that wants to come up. So Nicole, you want to lead off?
Thank you so much for having us here today. My name is Nicole Woolsey. I'm the Community Development Manager for the American Cancer Society here in Thurston County. One of our focuses, we have a really fun walk coming up on October 21st. What we do with the money from our Making Strides Against Breast Cancer walk is really pull together people to celebrate the survivors and the road and the journey that they've been on, and also to support their caregivers. The money that we raise with this fundraiser goes directly to breast cancer research, and we also support our survivors and our patients with free services such as rides to treatment with Road to Recovery. Reach to Recovery is a support system with breast cancer survivors that are 2 years out of their journey, supporting one-on-one support with a newly diagnosed patient. We also have hotel partners, so that if people are traveling more than 50 miles to their treatment, we can take away the obstacle of traveling every day, the cost, and the stress of that while they're going through treatment, possibly up to every day for several weeks in a row, and we make sure that they have somewhere to stay that's going to be comfortable for them and their caregiver. We also have a campaign called Real Men Wear Pink, and what we have done is charged male leaders in our community to get involved, because not only men get cancer too, breast cancer, but it is their mothers, their daughters, their aunts, their grandmas that are getting breast cancer and that they're supporting and sometimes losing. So we are very blessed in Thurston County to have many of these people here that are support as volunteers, as we are a volunteer-driven organization. I'm the paid staff in Thurston County. Everybody else does it out of the goodness of their heart because of whatever their journey has been with cancer. They come, they step up every day, they lead us in the fight, and we're leading the fight strong because we do it together. So thank you for having us here. This means so much to be able to help us get get us in front of other people so that they know the services and the help that's available to them in Thurston County and really make a better impact in our community.
Nicole, a little bit about the kickoff and how many Real Pink Men you have in terms of membership.
So the Real Men Wear Pink campaign now has 17 with Bud Blake.
I recruited myself, okay.
Registered candidates. What the Real Men Wear Pink do is they commit to wearing pink every day in October and raising up to $2,500 or more dollars so that, and to raise awareness with their social media or wherever their outlets are. So really being in front of people, because I can only talk to so many people, and although I talk a lot, I can only reach so many people, right? So this is men who are in the community saying, like, I have these people in front of me and I can make a difference, but we have to have people talking about it. So things like wearing pink, people start asking a question, why are you wearing pink every day, Bud or Joe or Jeff? You know, what's making you do that? And then they can talk about why they're passionate, because we're all drawn to the cause for a different reason. Maybe you're a survivor, maybe you're a patient, maybe you're a caregiver, maybe you're a healthcare professional, maybe you just hate cancer and you just are sick of hearing about cancer, right? So whatever brings you out and makes you passionate, that's what everybody has really agreed to step up and talk about. And so people realize that cancer doesn't discriminate. It doesn't matter how old you are, it doesn't matter what color you are, it doesn't matter your religion. Anybody can get cancer, unfortunately. And so with us getting awareness out about doing your self-awareness checks, going and getting your mammograms, talking to your doctor about what's right for you, finding out about if the breast cancer runs in your family, do you have the BRCA gene mutation? You know, these are the things that we need to be talking about so that people can have their lives saved. And what it is you have to have early detection, you have to be aware. So really hope everybody will take Shelly's lead and go talk to your doctor, go get a mammogram, and do your self-awareness.
And last task, just by first name, can you name all the people from the American Cancer Society sitting here with us?
Yes, I can. Oh, this is a test.
Yeah.
We have Corinne Wall here, and she's on the board. We have Joe Toner, Jeff Coles, I'm so sorry. They're all on the board. We have Jeff Perez, who's one of our Real Men and our flagship sponsor with TRA Medical Imaging. LaMarco Mitchell, who works for the American Cancer Society. Bill Wise, our logistics lead for our breast cancer walk, making strides against breast cancer. Nathan McGee, one of our Real Men Wear Pink. Alexa Warden, she is one of our youth ambassadors and has joined our Making Strides walk. My niece, Presley Littlejohn, she comes to anything she can and just rallies with us. Heather, she's here to support all of us. We have, oh my gosh, Amanda, I don't know why I almost messed up your name. Amanda Hanks, our survivor caregiver lead for Making Strides, and Jeanette Lee with South Sound Radiology, our presenting sponsor for Strides, and on the leadership of our Strides walk.
Yay.
Thank you.
Yep. All right, Corinne, how you doing?
I'm doing great, thank you, Bud. Thank you also for the opportunity to be here and accept this proclamation on
Can you
behalf
do me a small favor? Move the mic up just a tad so we can hear you. There you go.
Is that better?
Right into it. Mhm.
Okay. On behalf of the American Cancer Society and for all survivors, I am a breast cancer survivor. On August, I had my 1-year clean scan, so yay for that. I love to think of October as breast cancer awareness, but what I really think of it as breast cancer screening awareness. As Shelley alluded, we can help our survival rates with early detection. Screening is 3 forms. It's your clinical exam from your doctor, your mammogram, ultrasound, or MRI, and your breast self-exam. And so if you're not doing all 3, you're not screening the way you should. I'm also working really hard to bring awareness to the BRCA gene. We had a reference to that. The BRCA gene is the gene mutation many people know Angelina Jolie. That was really the kick to my gut when I found out I had my diagnosis, was that I am positive with the BRCA gene mutation, and I'm the mother of a 22-year-old daughter. So immediately I go from patient to mom. Unfortunately, my daughter and my sister both are positive for the BRCA gene, and my daughter just underwent a prophylactic double mastectomy at the age of 23. So bravest young woman I have ever met, and sorry if I get teary. She is working really hard to make sure people understand that the diagnosis of a positive BRCA gene mutation does not mean that it's a death sentence for you. It means you have options. And so we are working really hard to get the word out to people to get tested. If you had breast cancer under the age of 40, you had a parent who had breast cancer when they were young and now they have ovarian cancer, go back and get tested, because that opens up options for insurance to pay for twice-a-year screening, prophylactic choices like my daughter made, and really will save lives. So that's our family's personal mission, is to get the word out not only about breast cancer and breast cancer screening, but about gene mutation testing. The American Cancer Society and the work that they do has helped lead to the research that found that BRCA gene and ultimately saved my life and my daughter's life. And so thank you to Bud, my best friend Bud, and all of your partners here that are making this possible for us today. Thank you.
My name is Carrie Trout. I'm the breast patient navigator that works in the partnership with South Sound Radiology and Providence. And my role as a patient navigator is we, hope for those screening mammograms that they're going to be negative, but if they're not, I'm there to be with the patients for those next steps. So I meet with patients when they're told that they need to get a breast biopsy, which of course is a very unsettling time. And so my goal is to work with patients, get them scheduled as quickly as we can. When we know that they're high-risk patients, immediately getting them scheduled for the genetic counseling, working very close with genetic counselors, getting them in for surgical consults. Oftentimes patients, we can get all of those appointments lined up to just expedite patient care. And worked a lot with breast cancer screening and awareness as well. And with Providence and South Sound Radiology, we certainly are there to serve uninsured and underserved women in our community.
Thank you so much. Carrie. Kyle. Uh-oh. Just bottom up. Pull it up. There you go.
My name's Kyle Cronk. I'm the president and CEO of the South Sound YMCA. It is also very emotional to talk about this topic, so I'm going to be very brief.
Okay.
I lost my mom to cancer, and my father-in-law has cancer now. The South Sound YMCA has been working with cancer survivors for the last 6.5 years. We serve over 400 people that are diagnosed and through treatment. Following treatment, you can come into the South Sound YMCA free of charge. It's a 12-week program. It is an amazing program. My mom started our Livestrong program that we partnered with YMCA of the USA. She was the first graduate of that program in the Seattle Association, and we brought that to the South Sound Y. So reach out to the South Sound Y. We will make sure that after diagnosis and through treatment that we'll help build you up after that. Thank you for your work.
Oh, yeah. Thank you, sir. Is there one more person? Amanda? Okay, yeah, go, Amanda. Yeah, sure. There you go. You got it.
Hi, I'm Amanda Hanks. I am a caregiver for my mother. She is clear of cancer now. My mother was diagnosed with cancer in 2012, stage 4 metastatic, incurable breast cancer. They gave my mother 2 years to live, and my mother said no. She did 6 rounds of chemo, and she lived a normal life throughout chemo. Most people did not know that she was fighting cancer. And so my whole goal is that I need to bring awareness to cancer and let people know that if you do get that, oh, you have 2 years, you can say no. You can take care of your life and say no. My mom literally did it. Her doctor was amazed that she wasn't sick. Her doctor was amazed that she worked a regular full-time state employee job throughout her cancer treatment. She wore a wig, and nobody knew she had cancer until 2 years later when she was in remission, and it was breast cancer month, and she went to work and wore a baseball cap instead of a wig. And so ever since her treatment, every day in October, I wear pink, and I post a factor statistic on social media about breast cancer to raise awareness. I am young. My mother was young. She was under 40 when she was diagnosed. And people that are young, like I am, aren't paying attention to breast cancer. They think, oh, it can't happen to me. But being young, I hope that people see that I'm standing up here and I'm posting on social media. I'm a volunteer for American Cancer Society because it can happen to you and you should be paying attention. And you should be doing your self-awareness and getting checked. And now, because my mother got it so young, I will forever get checked twice a year, young, very young. Within years, I will start getting checked for breast cancer. And so other people my age need to know that this is happening, that breast cancer can happen. It can happen to anybody. It can discriminate. And with all of the help of everyone here that is doing the donations, the walk, the awareness, if you guys weren't doing it, my mom wouldn't be here. She wouldn't have had the treatment and the research that we have now to make her in remission. She literally stands working a normal job. She has grandchildren, children. I haven't had children, and she will see my children because of all of the work that everyone here is doing. So I just want to seriously thank all of you because you guys are what makes cancer treatment and research happen. Thank you.
All righty. Yeah, go ahead. We love you, Amanda, and we love your mom, and thank you for telling that story. So now I'm going to ask if there's any questions, if there are any comments from you or about this, and any stories you want to share.
You asked me if I'd say something.
Yeah, sure. Go ahead.
Oh, you have a box.
That's his turn.
Go ahead.
Need a minute?
Nicole knows my story. You know, for one of the hazards of living over 70 is you get to watch some of your family not make it. So far, my daughter's made it. That's all.
Okay.
Yeah. I'm with you.
For the record, my eyes are always moist because I'm too emotionally detached from life to show emotion.
But
However, my dad in 1973 died from cancer. And it was amazing to see this big guy, reduced to the point after chemo, 6 months of chemo and radiation, where he looked like Twiggy, and I had to walk him to the bathroom.
hold on.
And when you're 18, that's not what you expect. And then what you also don't expect is that it will impact you in your own life. And it was October of 2011, I was diagnosed with cancer. I had a 2-inch by 2-inch square tumor at the very, very base of my throat attached to my tongue. And after 3 months of radiation and chemo, it's gone. And that's been almost 6 years this coming January, will be 6 years clean. And it just impacts your life, as I was telling Kyle and whom else, anyway, that the ripple effect, because that was the same time my son came back, as I was diagnosed, came back from Iraq after being blown up with an IED, and he came back to hearing Dad's got cancer. And it impacts their daughter, and impacts in-laws, it impacts everybody. And the day I was diagnosed is when my wife told her boss, I'm done. I'm quitting because I'm staying home to take care of my husband. So she stayed home and took care of me for three months, well, longer than that. And then she went back to work after I healed. And you realize, holy moly, the support that you need. And I would still go to treatment up there on 6th Avenue in Lacey. And my wife's there with me, and I would see single mothers coming in with their toddlers by themselves and going in for treatment. And I thought, good grief, how do they do it? Because I was a big baby. And I saw these all ages, people coming in alone, and befriended a couple of them. And it's just heartwarming. So the support that you folks provide is immensely important, obviously important to healing in so many ways that most people don't even realize. So I truly appreciate you. And thank you so much for all of you coming out en masse today for this.
I'm going to try one more time. Okay, good. We're going to get a photo of everybody in just a second, but my pitch is, and you've heard it before from the kickoff last night, if I could just ask anybody and everybody that's listening on YouTube, which is live and as it recorded, the 21st of October is the walk at 8 a.m. I forget where. Where? Huntemer Park in Lacey. This is how you do it. You get your information and learn awareness and education yourself and others around you, and then you participate. It is those 3 steps that what this needs to be done in terms of getting involved in such a way that's fitting for you, at your individual level, community level, family level, but get involved. That's how we help each other out, and it is all about support at that point in time. So with that in mind, I ask y'all to come up here, and we're going to stand in the you want to do the proclamation? I'm so sorry.
I'll read it.
I get it fast. Yeah, you read it. Yeah, you try it.
I can do this.
Oh, yeah. Okay. We're going to read the proclamation, hit a photo. Sorry.
Breast Cancer Awareness Month. Whereas the month of October has been nationally designated Breast Cancer Awareness Month, and whereas every year too many Americans are touched by the pain and hardship caused by breast cancer, a disease that among women is not only one of the most common cancers, but also one of the leading causes of cancer-related death. Although both men and women can have breast cancer, women are at a higher risk. And whereas in Thurston County alone, over 270 residents are diagnosed with a type of breast cancer, and about 50 die from the disease on average in a given year. And whereas Thurston County Board of Health supports these individuals and their loved ones who give their unwavering support I just can't pronounce this word. During the month, or during the most trying times, and we recommit ourselves to the essential and necessary work of forging a future free from cancer in all its forms. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims October as Thurston County Breast Cancer Awareness Month in honor of all those who lost their lives to breast cancer, and recognizes the courageous survivors who are still fighting the fight, and encourages citizens, other government agencies, private businesses, nonprofit organizations, and all other interested groups to join in activities that will increase awareness of what Americans can do to prevent breast cancer. Adopted this 10th day of October 2017, signed by your Board of Health.
Thank you so much. Very much. So if I get Nicole, Kyle, and is it Carrie, Miss Trout? Carrie, yeah, I'm sorry.
And the sandwich board. Bring the sandwich board out.
Oh, wait, we're going to do that in a second. I'm going to give you the things, and we're going to get a photo together. Let's go down.
All right.
This is how we do it.
Oh, the sign.
Bring it forward. No, everybody. Bullshit, everybody. All that. Try to be the beat. There you go. Come on, that right there. There we go. We can do this again. Yeah, that'd be great. Show 'em mine. Ready? 1, 2, 3. Can you see the sign? Yeah. It's not big enough. All right. Thank you so much, everybody. Thank you.
Nicole knows the story.
Rodeo. That is so cool.
for number 2? Shelley, you ready for number 2? Okay. The second proclamation is the proclamation that we want to address as far as Domestic Violence Awareness Month. And you see purple on us and some of those in the room, and that purple is the color for domestic violence for the month of October. I'm going to ask Shelley to kind of frame it, and then we're going to bring up a whole host of guests and have them present. Go ahead, Shelley.
This is a very emotional Board of Health meeting.
Yes, we today, yeah. October, yes.
So yes, I'm here to ask the Board of Health to proclaim October Domestic Violence Awareness Month. I have the honor to serve as the Vice Chair on the board of the Washington State Coalition Against Domestic Violence, which is also known as WSCDV. The mission of WSCDV is to mobilize member programs and allies, many of whom are here in this room today, to end domestic violence through advocacy and action for social change. I mention WSCDV because WSCDV calls this month Domestic Violence Action Month, because we need to do more than just be aware of that domestic violence exists in our community. In Thurston County this year alone, we've had several women murdered by their intimate partners. And there are at least 30,000 survivors of domestic violence that live right here in Thurston County. Every 9 seconds, someone in our country experiences domestic violence. So in the course of this meeting alone today, there are 600 people that will suffer abuse at the hands of their partner. Domestic violence is a crime, but it's also a serious preventable public health issue. People who survive domestic violence are more likely to get sick, miss work, suffer from chronic diseases, sexual assault, depression, and die early. Children who witness domestic violence experience one of the most harmful adverse childhood experiences that affects their health for life. This is a very personal issue for me, as I am a domestic violence survivor myself, and it's people like those here in this room that I credit with the fact that I'm here today. So I'm here to accept this proclamation and say a few words about their work in Thurston County. Are several partners in this community who each play a very important role in ending domestic violence, supporting survivors, and holding perpetrators accountable. So at this time, I would like to call representatives from the Thurston County Prosecutor's Office, Thurston County Sheriff's Department, Thurston County Clerk's Office, the Family Support Center of South Sound, Safe Place, members of the Domestic Violence Sexual Assault Task Force, and the Coordinated Community Response Team to please come to the podium. And in this room, we have several elected officials representing those departments. Thurston County Prosecutor John Thunheim. I know this is one of your dear causes. Thurston County Clerk Linda Enlow is here. And Carla, are you representing the sheriff's? Lieutenant Redloff.
Okay.
So please all come up to the podium to accept the proclamation, and feel free to talk about your work in this community around domestic violence. Thank you.
Mr. Thunheim, are you going to? Oh, okay, go ahead, yeah.
Hello, everybody. I'm Sarah Lloyd, and I am the Executive Director of Safe Place. It's my distinct honor to serve this community in supporting domestic violence survivors firsthand, and to work with them to provide not only shelter for them and their children often. At any one point, at least 50% of the people in our shelter are children, and more likely it's 8-year-olds and under. So thinking about not only does the domestic violence in our community happen, but it's impacting a lot more than just the direct survivors. And it's happening a lot. We're seeing it on a rise. We offer 4 different 24-hour supports inside of our services. So we do helpline support, we do shelter, we also offer direct advocacy for individuals who are experiencing violence. And in all of those situations, we're seeing not only the frequency of events happening, but the drastic nature of the violence that people are experiencing is also increasing. And so to know that, number one, not lighthearted or fun at all, but it's important for us to pay attention to that, and to also know that the more we unify our efforts as a community, the more impactful we can be. The more knowledgeable we are about the signs and the signals of domestic violence, the more impactful we can be. And as we rise up as a trauma-informed community, we can respond in ways that help all survivors feel supported as they come forward saying, I've had enough, and you also need to have had enough so that I have somewhere to go with it, and that there's somewhere for me to land softly as I move on in rebuilding life. A lot of times people don't come forward for a long time. Sometimes we see people go through cycles that look like them leaving and going back and leaving and going back, and a lot of times that's met with judgment, right? Especially if we've never been in domestic violence, we don't necessarily understand domestic violence and how hard it is to break that cycle. So I stand before you today both as an advocate and a supporter of this cause and as a survivor myself. It's important for us to unify our efforts and to really stand behind our community members as they go through this so that we can become a community that not only supports violence as it happens, but we also continue to build a community in which violence no longer exists. So on behalf of Safe Place, I'm so thankful for all of the support that you all have offered us in the past and continue to offer us, and the partnerships that we can continue to move forward and build together. Thank you.
Thank you so much, Sarah.
Good afternoon, Commissioners. My name is John Thunheim. I'm the County Prosecutor, and I'm just going to make a couple of comments to illustrate some of the themes that I think are already coming out today. And might I say, boy, you picked a couple of doozy issues for today. But needless to say, both incredibly important issues, and I'm so honored to be here to talk to you about the domestic violence piece of today's agenda. I think it's really important to recognize that we're standing before you today as the Board of Health and not as the Board of County Commissioners.
Exactly.
Over the last several years that we've done this proclamation, and we've been doing it for many, many years, as I'm sure you know, we've always done this at your Board of County Commissioners meeting, not at a Board of Health meeting. And as Shelley talked about when she was framing this, that this is really both. It is a public safety, a criminal justice issue, but very much a public health issue. And I think that it's important for the listening audience to really recognize that we're here today before you as the Board of Health and asking you as the Board of Health to proclaim this a public health and a public safety issue. And in response to that, I think it's important to know that what we've developed and what I think are probably our best strategy in dealing with domestic violence is to bring all of those systems together and to work collaboratively. To not only bring all the public health and the social service agencies together, but law enforcement, criminal justice, all to work together collectively in a coordinated way to provide support and safety to victims and survivors, and then to hold those who perpetrate these crimes accountable for what they've done. And it is really that strategy that I think we are trying to illustrate to you today with all of the various partners standing in front of you talking about the role that we have, but also the work that we're doing together. The other thing I want to bring to you is that this is an issue that while it is a national issue, it is a Thurston County issue. As you've heard, unfortunately this year we've experienced more domestic violence murders than we have in many years in the past. 4 women have lost their lives today, as of today, this year, to domestic violence homicidal acts. We've also had 2 suicides associated with those cases, and many, many, many other crimes. In fact, the statement that I think Sarah was talking about with seeing an increase in the level of violence that's going on is being reflected in our data as well. We have seen a substantial increase in the number of cases being referred to us for felony charges with domestic violence in the domestic violence category, as opposed to the misdemeanor assault charges, which tells us that the level of violence is increasing. And so this is something that is here now that we need to deal with, and I'm really pleased, again, that you're here as the Board of Health proclaiming this a public health issue. Now, I need to make one more comment, and that there is somebody missing here today that couldn't be here. And you know this I was going to say person, but I can't really say that because it's Marshall.
Oh,
Marshall, our courthouse dog, would normally be here.
yeah, you would.
As you know, Marshall works with victims and survivors, including children affected by domestic violence, both here at the courthouse and at the Family Support Center. Earlier this week, we received a call and a request for assistance to help with the victims of the tragedy in Las Vegas. And so Marshall and his handler jumped on a plane, and they traveled. They're in Las Vegas now working with victims of those horrible events that occurred down there. And we expect them back later this week, and certainly are telepathically sending them our support, but we wanted you to know about the work that he's doing down there. But in substitution, I'm pleased to present you each with a Marshall card so that you don't forget about Marshall. And then I also have for you, and you may already have many of these because we do this probably every year, but I have a new pin for you that's the Domestic Violence Sexual Assault Awareness ribbon.
Great.
And I'd like to present each of you, if I could approach, with one of those.
Are those cards autographed?
Have Marshall come over and autograph.
With the tongue.
Thank you, sir. Is this the one we got at the 100 Man?
It's it's basically the same one.
Okay.
Yes.
Okay.
Thank you very much.
Yeah.
Thank you.
Do it right now. I got my Marshall card. We're good.
Hi.
Linda.
Thank you for this opportunity. My name is Linda Meyer-Enlow. I'm your Thurston County Clerk. I just want to point out one stat and also recognize my staff who works with victims every day. Last year, they served over 2,486 victims who were seeking protection orders. And it's daily, the stories that they hear in working with all of these victims. And so I want to recognize the staff that does that. Where'd they go? Beth Holbrook is a domestic violence liaison, and her partner, Regina Tercero, also. And Natalia Palomino is a victim advocate who travels between my office and the Family Justice Center and works with victims also down there. Thank you very much for all the work that you do.
I'll just be very brief because we're on the agenda later this afternoon for our Family Justice Center to speak about the programs and services that we offer. But I just wanted to acknowledge that much like breast cancer, domestic violence affects all of us. It affects our mothers, our sisters, our daughters, our friends, and sometimes our nephews, our brothers, uncles. It affects everyone. And it is a serious public health issue, and we really appreciate being here today to talk about this and for the acknowledgement by the Board of Health that this is an issue for Thurston County and all across the nation that needs to be addressed and recognized. So thank you very much.
You bet. Thank you, Trish. Hillary, did you want to say something? Yeah, come on. I got to have Hillary here.
Sure, thank you. I'm also on the agenda to report on the Women's Health Coalition, so I'll also keep my comments brief. Just to say that the YWCA nationally is one of the largest networks of services for survivors of domestic violence and sexual assault. We know how pervasive this issue is, and I just want to thank you for your proclamation today and really give thanks to all the organizations in the room that do the direct service work to support all of our survivors here, and the YWCA is happy to partner in the way that we do, so thank you.
You bet, Hillary. Thank you. Did the lieutenant want to come forward and say something on behalf of the sheriff's office? No, you don't want to do that? Okay. Okay. Anybody else that want to say anything? Okay, do you want to say something?
No, I blew it on the last deal. That's okay.
Yes, I'm number 7 of 9 kids. And so about 10 years ago, I was still with Olympia Police Department, and my oldest sister called me, and she has 2 daughters and a son that are older. And she said, she was in tears, and she said, John, I can't find Richard. He didn't show up for work. And it was in a different state, but he hasn't shown up for work, can't get a hold of him. of course, you console your sister. He'll turn up, you know, blah, blah, blah. And you go through all the typical stuff thing. He's going to show up. Long story short, he didn't show up after a week, and they found him murdered by his wife. Tell me that didn't send a shock through the entire family. And thankfully, she's in prison for life now in Nevada. But no, as with the cancer and DV, it doesn't know any socioeconomic boundaries, or it knows nothing. It is relentless. And I believe it is absolutely preventable. And I can't think of the hundreds of domestic violence arrests I've made over the years, and it always felt good to do that. It always felt good. One of the rewards of the job. So I thank you for all your advocates. Safe Place, well, we leaned on you heavily, and still do. I'm sure they do. But prosecutor's office, the courts, everybody, Marshall, that's way cool. Great. Thank you so much for all you folks do.
I just have to say something that my mother was famous for saying, and just very simple: love one another. So simple.
That works, doesn't it? Yeah, okay. For me, I think it's an abomination that a man has to raise his fist or any other withhold food or water. I've seen it around the world for me and some of the missions I've been on with the military, and to come home and find out that it still happens here. I know that they spoke to it. I grew up in a family that's love and care, all Southern, and that doesn't mean it's any different than any other family in the world. But like his mother, my grandmother used to walk around saying, ain't no woman, ain't no world, in the sense that you will respect me and for what I am, and I know you're strong, but you just don't hurt a lady like that. And so it hits home. I don't have that problem in our family because of my grandmother, and it is very, very clear that you're absolutely right. Love one another. And so I thank each and one of y'all for coming here today and speaking on behalf, and I'll ask him to read the proclamation so I can stop right there.
Yeah. It's lengthy.
Yep, hang on.
Whereas the month of October is nationally designated Domestic Violence Awareness Month, and domestic violence is a preventable, serious public health issue. And whereas domestic violence is a pattern of assaultive, coercive, dominating, and punishing behaviors perpetrated by one intimate partner against another and impacts people of all ages, genders, races, and socioeconomic status, and disproportionately affects people from marginalized communities. And whereas we acknowledge that those who lived through violence and abuse as survivors, we acknowledge those who live through violence and abuse as survivors. And each year there are more than 10 million people who are hurt by their intimate partners in the United States. And whereas domestic violence causes physical injury, mental anguish, economic loss, and death in our communities. In Washington State, from 2006 to 2015, 563 people were killed as a result of domestic violence. And whereas in Thurston County alone, 14% of adults, 21% of women experience domestic violence at some point in their lifetime, and 29% of 10th graders witness it. And whereas in Thurston County, the Thurston County Sheriff's Department and other local law enforcement agencies responded to over 4,734 calls related to domestic violence, while countless other victims suffer outside the criminal justice system. And whereas victim advocates for the Thurston County Prosecutor's Office provided advocacy services to over 1,500 victims of domestic violence, and the Thurston County Clerk's Office completed 2,486 interviews of victims seeking protection orders. And whereas multiple tribal nations, local government, and nonprofit community organizations and advocacy groups, such as the Thurston County Domestic Violence Sexual Assault Task Force, Safe Place, the Family Support Center of South Sound, the Washington State Coalition Against Domestic Violence, the YMCA, and others coordinate with each other to prevent and respond to domestic violence. And whereas the Thurston County Board of Health together with the Thurston Thrives Education and Resilience Action Team, Public Safety and Justice Action Team, and the Thurston Coalition for Women's Health support the efforts to promote healthy relationships, protect the safety of survivors, and reduce harm to children, child witnesses, and others through an increased focus on regional cooperative strategies. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims October as Thurston County Domestic Violence Awareness Month, encouraging all county residents to take action to end domestic violence in our community by learning about the impacts of domestic violence, creating policies in their workplaces, engaging in discussions with family and friends, and supporting victim service providers and those working to hold domestic violence offenders accountable. Adopted this 10th day of October 2017, signed by your Board of Health.
Yay. Okay, so I have Sarah, Trish, Linda, the LT. Yes, you're coming forward, LT, on this one. Hillary and John to come get each one of these, and then we'll all get a photo together. So. Thank you. Okay, so the next item on the agenda is the opportunity for the public to address the Board of Health. Is there a sign-in sheet by chance? No? Can you look real quick for me, Romero, and see if there's a sign-in sheet? Well, I meant one filled out. Okay. Cool.
Jack.
Okay.
Follow that.
No, I can't do that. Is it no? Okay, sure. Okay, so I'll just look out to the audience to see if there's anybody in the public wishes to come to address the Board of Health. And seeing we have no one, I'll just move on to the next item, which is a departmental item. No, Jack changed his mind. Changed his mind. Yep, he's good. He passed. So the next item is a departmental item. It's or do we want to, oh, here we go. I want to set I'm just making sure I got my stuff straight here. Hang on. Okay, yep. Thurston Thrives update is the women's health, and I think we have Mr. Chris Hawkins, and he is going to tell us with Hillary. Come forward. Yeah, come on, Hillary. From the YMCA, and this is all about background on women's health, right?
Correct.
Sure, you got the floor. Go ahead.
Thank you, Commissioners. My name is Chris Hawkins. I'm Community Engagement, Evidence, and Partnerships Manager with the Health Department. And just wanted to quickly give a few words of introduction to this item, the Thurston Thrives update, which this month is featuring the Women's Health, Thurston Coalition for Women's Health. The coalition was begun back in 2011 under a multi-year grant from the federal U.S. Department of Health and Human Services Office on Women's Health. That grant ran through 2016 and had an initial focus on boosting preconception health for Thurston County women. As a strategic planning year came to a close, we realized that we actually had an agreement on a priority to focus on preventing violence against women with this coalition. So the community spoke very clearly that that was the area that they wanted to focus efforts on. And so from there, the coalition then began an effort to intervene early in violence by trying to foster healthy relationships through community campaigns and through programs for middle school age girls. And that coordination of campaigns and communication happened throughout that grant. The membership of the coalition was a broad-based, multi-sector partnership that included many health-related organizations, including over a dozen local nonprofit organizations, CMAR, Providence St. Peter Hospital, St. Martin's University, and other higher ed, as well as a number of other interested groups and people in the community, including our own health department and the prosecuting attorney's office here in Thurston County. As this grant wrapped up in the last year, we engaged the coalition in thinking about how they could sustain the effort and keep the coalition going. It had been led a lot by the county and the health department over the first several years of its existence. And then we agreed with the partners that this effort needed to continue. And they thought that a co-chairing relationship with a couple of nonprofits leading the way for that coalition would help it continue. And we're happy to say that that has been the case in the past year, that led by Family Support Center of South Puget Sound and YWCA of Olympia, that coalition has continued to carry on its efforts. And Hillary Sowens, Chief Executive Officer of the YWCA of Olympia, is here today to share with you a little bit about the current focus of the coalition and how it connects to the Thurston Thrives action teams like education and resilience and public safety and justice. Thank you.
Okay, thank you, Chris. And as Chris mentioned, Trish is also the co-chair of the Thurston Women's Health Coalition and is here to co-present with me today. We have been very thankful to participate in the Women's Health Coalition for many years now, and as Chris mentioned just recently, of course, the coalition transitioned leadership from the County Department of Public Health and Social Services over to our community-based agencies. However, the membership has remained fairly stable throughout that transition, and we have a lot of folks who were with us over the course of the past 5 years have continued to serve. And as Chris noted, of course, the Women's Health Coalition has had an emphasis on developing multiple strategies related to gender-based violence. And the group has focused on supporting young people, specifically young women of middle school age, around multiple interventions, which included Girl Circle, which many of you are familiar with and have heard about, which served up to 14 middle schools throughout the county, as well as engaging in some healthy relationship messaging strategies led by Together. And recently, with the transition of coalition leadership, we felt that it was a nice opportunity to re-engage that group with a little bit of a refocus and mission alignment, and that group did reaffirm our commitment to gender-based violence. And we're specifically still focused on gender-based violence that impacts the young people in our community. And we are focused now a little bit more broadly on young women and female-bodied folks who are in grades 8 through 12. This came about for a few different reasons, one of which is a data book that Marianne O'Garo prepares for the Thurston Women's Health Coalition, which really pointed to some alarming statistics related to gender-based violence facing this age group specifically. So we've got some slides here. And again, this is just a small portion of that data book that Marianne presents, but some of the slides that we thought were pertinent to this presentation. Oh, great. So the slides here are specifically focused on female residents. As you can see, most of this data came through the Healthy You survey. The full data packet also includes statistics from the BRFIS as well. So as you can see, adverse childhood experiences were specifically focused on lifetime sexual assault in this slide among female Thurston County residents. As you can see, 32% of 12th graders have experienced sexual assault in their lifetime, and there's a pretty substantial jump from 8th grade up to 12th grade again. So these will highlight why we're really focusing in on that age group.
Am I standing right in your way?
No.
Oh, yeah, so as part of the coalition, really, we wanted to hone in on some very specific things that we could make actionable results on. And we were looking at some of these slides, looking at the sexual assault across a lifetime, acknowledging that 29% of women had been attempted, or young girls that had been attempted forced sex, and 14% that was a successful forced sex. And interpersonal violence, the data and the statistics were similar. 10% of 8th graders, 20% of 10th graders, and 16% of the 12th graders had experienced interpersonal violence. I can't see this one.
This points to a statistic, of course, that we just heard through the proclamation around witnessing domestic violence as a child. So you can see 18%, or personally have experienced domestic violence, 21%.
And mental health, anxiety, looking at the female current residents again, that 29% of 8th graders acknowledged that they had experienced anxiety. 10th graders, it was 46%, and 46% in 12th graders as well. And when you look at that number and you think 46% of our 10th and our 12th graders have experienced anxiety, and we're not just talking about feeling anxious about a test, but to the level that they considered it to themselves to be a serious health concern. So that's pretty staggering. That's almost half of the students in those age groups. Depression, same thing. In serving on the Education Resiliency Action Team, one of the things that we had talked about over the past year was looking at suicide and depression and the increase that we were seeing in those in the Healthy Youth Survey, and just anecdotally across the different school districts. And I serve as a school board director for the Griffin School District, and that was something that our administration had also been acknowledging and asking about and looking for more resources around. But when we saw these statistics again, we knew that we were on to the right thing by narrowing it down to looking at these age groups. But 35% of 8th graders, 47% of 10th graders, and 46% of 12th graders have experienced feelings of depression, so much so that they weren't able to manage their daily activities. You want to take this one?
Sure, and we won't go into detail on here, but you can just see the disparities between low-income female residents of Thurston County and those who don't qualify as low-income. And so, of course, there's a difference there. We know that income is an indicator. So with these statistics in mind and the goal to continue to focus on gender-based violence, the Thurston Women's Health Coalition has really looked at sort of 3 pieces of data that we're particularly interested in: sexual assault, dating violence, and sexual harassment, which wasn't necessarily highlighted in the slides. The reason that sexual harassment is of particular interest to us is that we know that it's part of that continuum of gender-based violence. Also, we have, of course, across our agencies, many youth participants who we get feedback from about their experiences at school and in our programs. Some of our youth are engaged in our YWCA Youth Advisory Board, and recently they participated in a participatory action research project, which is a mouthful. Essentially, they surveyed and interviewed peers within both YWCA programs as well as peers at school to think about sort of the broad question of what are the barriers to empowerment facing young women in our community. And they stepped away after doing all of their research and data analysis. Their finding was that self-confidence was the biggest barrier. And from there, they really pinpointed sexual harassment as an issue that they wanted to tackle and that they felt was pervasive. So based on the data, as well as what our youth participants are telling us, we've decided, of course, to continue our focus on gender-based violence, but for now have a singular focus on sexual harassment facing young women who are in grades 8 through 12 in our county. And so with this, we really want to, of course, engage youth in understanding the building level dynamics that are at play, as well as working with our coalition partners to look at building level policies and processes related to Title IX protections and reporting. This is, of course, really timely as well due to the current federal administration's decision to rescind and replace Title IX, which, as you all know, provides guidance on responding to and investing school sexual assault. So we want to make sure that we really uphold solid processes and policies and make sure that our students know that they're supported and that we take accusations of sexual harassment, of course, sexual assault, very seriously. Just to highlight this, we have, of course, collected, as I said, testimonials from students, and I wanted to bring forward a testimonial so that you know what some of our young women in our Thurston County schools are experiencing. On a school trip, I was physically intimidated, cornered, and meant to feel unsafe. Name was blanked out. Blank has cornered me, pushed himself on me, and despite being talked to multiple times in a few days, he would not stay away from me. I would try to switch spots, move myself, but he would keep following me and forcing interactions. I also know that he's groped my friend multiple times and tried to force sex on another friend. We've tried reporting, but we're always asked, where's the evidence? I also know blank brought a knife along onto a school trip and showed 2 girls. Blank is also a big problem. He's slandered girls, claimed that he's had sex with girls he hasn't, made comments about girls' bodies, including myself. He hits on almost every girl in the school, even when we say no. He makes girls cover themselves up and feel ashamed. He'll talk to his friends and get them to join in on comments. I feel unsafe, unprotected, and unheard. I am sick of this. I came here to be safe. Make it safe. We hear this over and over and over among our participants at the YWCA, and I'm sure the same is true among participants at all of our community-based agencies. So we're really committed to engaging young women who experience this dynamic in their school in the process of developing solutions that work for them, that make them feel safe to report, and that make sure that when they do report, they feel validated, heard, and that there's a process that they feel comfortable with. Those are some of the issues that the County Women's Health Coalition will be focused on. In addition, as Trish mentioned, to looking at how our work intersects with different action teams of Thurston Thrives, and thinking about what specific goals we might want to see related specifically to women's health and sexual harassment among young people. Anything else that you want to add?
I don't think so. I think we covered the majority of that, but I'm just personally really excited about the opportunity to look at women's health from a holistic approach and look at how we can create systems and create goals for our community to further all of the various things that affect a woman's health. And it's just been a pleasure to work with Hillary and to step up as the co-chair, and appreciate you having us here to tell a little more about what we're doing.
Great, thank you. So we look forward to keeping you informed, and any opportunity to partner with the Board of Health would be welcomed as well, of course.
Yeah, we'll definitely be doing that. So, you have any comments, questions?
Just thank you for everything you do.
Thank you.
I do. I'm looking at the very first slide, sexual assault, lifetime female Thurston County residents, the 8, 10, and 12th graders. And I'm seeing the 13, 22, and 32%. Do you have any idea how much of that percentage are in-home versus school or outside of home?
Marianne would probably potentially be in a position to report on that. One of the things that we are doing as a coalition, which I neglected to mention, is that we're engaged in a pretty substantial survey with youth through our partnership with Safe Places Youth Speak program, and they're going to be collecting information on how often youth are experiencing sexual harassment, whether it's happening at school specifically, and again, what some of those dynamics are, so that we can just really have a better sense of where this is taking place, what those specific circumstances are, and then we can really develop strategies that work for different environments.
Thank you. And I'm glad to know you're out there not only helping to keep the young women safe and such, but giving them hope and resources and such to help their mental health. But with the advocacy that you do for the victims, do you have any programs in place that help to hold the perpetrator, the young dork, accountable for what his behavior?
That
I'm
might
generalizing.
Yeah, that might be a great segue into the Family Justice Center presentation.
Yeah, that's kind of my thing too. Yeah. kind of dork.
Yeah. I'm being respectful.
Okay. Well, I'll just tailor off of that because mine was the same way. You mentioned empowerment and engaging women and self-confidence or the lack of self-confidence as being the barrier. Maybe that's what Natalie's going to talk about, but the whole prevention piece of this and getting to the root cause. I know that you can't address it right now today, but is there anything you can just lend us as far as preventive efforts out there? And I guess kind of getting to the young dork thing. So, anything?
So one of the things as a coalition that we're working on is looking, and Hillary already spoke to this a little bit, but looking at what the policies and procedures are within each of the school districts and trying to come to some common language and a common understanding of what sexual assault or sexual harassment is. So that in itself is a prevention measure, and looking at identifying ways that we can hold the students accountable and ensure that the administrators and those that are protecting our kids within the schools take that seriously. Whether it happens at home or it happens at school, a sexual harassment or sexual assault affects the child's education. Primarily, a lot of sexual harassment happens via social media, and that carries into the school on the cell phones of the kids, and it's actually makes it even worse than a personal one-on-one interaction because of the humiliation that often comes along with that. So I think just really holding the students accountable, and in order to do that, there has to be a common language, a common understanding, and a common agreement that districts will handle this as an important issue.
Yeah.
Okay, any other comments, questions? No. Let's see if we can retrieve Natalie. She's going to give us a thing on partner feature overview of the Thurston County Family Justice Center, right?
So unfortunately, commissioners, we've had a minor challenge and change, and so Natalie is not here with us today. She had to emergently leave. However, I was able to wrangle one of our clients to come and speak with you. So, oh, she's coming in now. Thank you.
Okay. This is neat. No, don't be sorry.
This show and tell. This is great. Oh, look at that. Hope. Yeah.
You did.
PowerPoints are so 1990.
Natalie?
So first, I have to get my child out of the stroller. I don't know if you heard her, but she's crying uncontrollably. So just give me a second. Can you hold her? Yeah, thanks. Hold. Cradle her now.
Can you help with your sling?
Yes, please. She's still really little, so it's hard.
Yeah, just don't want to drop her out the bottom when you're trying to put her in.
Thank you.
There you go.
Good.
Just let me know how I can help.
I will. Thank you. So, like I said, baby's crying, and one of the first things that they offer when you walk into the Family Support Center is help. How can we help you, and how can we help you and your children? And did you know that the more that babies are held, the less they cry? One study found that frequently carried six-week-olds cry 43% less than others. Can you pass out some links, please? Thanks. So now that we've gotten my baby a little bit quieter, I want you to know that the mission of the Family Support Center of South Sound is working together to strengthen all families. Yes, all families who walk in the Family Support Center's doors are cared for and supported. Additionally, the beauty of the Family Justice Center program is that they can work with any survivor of domestic violence, sexual assault, stalking, or human trafficking. The Family Support Center building is located in downtown Olympia, right on the corner of State Ave and Capitol Way. They're generally pretty easy for people to access. You can take the bus, you can drive, walk, ride a bike. Access is really critical when someone is in crisis. They even have a partnership with Inner City Transit to purchase discounted bus passes each month so survivors can access their building, so survivors can get to work, they can get their children to childcare, and they can go about their daily lives. Once someone walks into the building, they're given options, kind of like when you walk into Fred Meyer. And today you walk into Fred Meyer and you need celery and diapers for your child, but tomorrow you need windshield washer fluid, tampons, and orange juice. You get to choose what you want that day. Or you can think of it like a menu. When you walk into a restaurant, you're given menus, and you get to choose what you want off of that menu. Survivor choice is really critical. Often, one of the primary needs of survivors when they walk in the door is, can anyone guess? Housing. Exactly. Domestic violence is one of the top causes of homelessness in our nation and in Thurston County. On average, 70% of all of those seeking services from the Family Support Center are impacted by domestic violence. Survivors are often the ones who have to leave their home to seek out safety. The Family Support Center is the coordinated entry point for all homeless families as well as single survivors in our community who are fleeing domestic violence. The Family Support Center has access to rapid rehousing dollars, some of which is from Thurston County, and the Family Support Center also has HUD dollars from the federal government for rapid rehousing assistance. Can you keep giving out links too? The Family Support Center also refers family. They partner with, for singles, they are able to partner with Sidewalk, a local community organization, so that they can access diversion funds and rapid rehousing assistance for singles. And it's one less place that the survivor has to go on their own, navigating it independently. Now with the Sidewalk located on site at the Community Care Center, just 2 blocks from the Family Support Center, collaboration is that much easier. They also refer families to Homes First, Evergreen Vista, private landlords. Some of the survivors they're working with are in need of immediate shelter. It's not safe for them to return home that day. One of the first calls they make is to Safe Place. Heck, they have each other on speed dial. They work advocate to advocate on the best and quickest way they can get a survivor to safety. And sometimes it's in Safe Place's confidential shelter. If it's not safe for the survivor to stay in the area, they will collaborate and leverage other community resources in order to get the survivor out of town and to where they're safest. Every day, advocates provide safety planning with survivors. What do you need to feel safe? How can we support you in feeling safe? What does safety look like? Sometimes, survivors tell their advocates that they've been strangled or choked by their perpetrator. Did you know that one incident of strangulation increases the chance of lethality by 800 times? One incident of strangulation, 800% increase in the likelihood that they will be killed by their perpetrator. Advocates weave in moments of education with survivors as well. They don't just ask questions to ask questions, but they empower survivors to know more about their risks and how to know more about what options they have. On site at the Family Support Center is the Olympia Free Medical Clinic, where survivors are able to go upstairs and seek medical professionals if they choose. There are also positive working relationships with local EMTs, fire departments, hospitals, the Community Care Center, Providence, and Capital Medical. As advocates, safety planning with survivors, it might be a discussion about a protection order. For some, this is a critical step in increasing their safety. For others, it may not be the safest option. Trained advocates are able to work with survivors and give them the options and accurate information so they can make the best decision for them and their family. On site is the Thurston County Clerk's Office. So a trained advocate, who you saw a little bit ago, who sits at the Family and Juvenile Court, she works on protection orders every day of the week. And she's on site at the Family Justice Center one morning a week to support survivors with complicated cases, filing paperwork, and answering of questions. Have you ever looked at a protection order? I think this is 12 pages, easily. Am I the petitioner or am I the respondent? Who's going to serve this? How do I answer any of these questions? Am I going to have to do this alone? Absolutely not. There's an advocate there who can support the survivor and go to court with them. They can even work on the paperwork and start filing of the protection order on site at the Family Support Center while their kids are running all around and have stuff everywhere in a safe and comfortable environment. And if a Family Support Center advocate isn't available, they will coordinate with a clerk's office. They'll call Safe Place to see if they have an advocate who's available. Trish, my baby's crying again. Will you take her? She might also need a diaper, and I think she's a little bit wet. So if we have any clothes, that would be really helpful. And thank goodness that the Family Support Center exists because they have tons of hygiene supplies. They have diapers, wipes, shampoo, conditioner. And while survivors are on site getting help with their protection order, their children are welcome. They can get the basic need items for their family while also accomplishing things such as filing their order. It's one less place they have to go to tell their story. When they're running low on items at the Family Support Center or a family needs something additional, they connect directly with the YWCA of Olympia so survivors can easily access the other bank. So let's do a really quick recap. I've been able to work on a safety plan, have the options to file a protection order with help. I can access housing assistance, shelter placement, lethality assessment, possible medical attention, and my child is being held by someone while I try to manage all of this. Got it. Last night I called 911 to report an incident of domestic violence, and my perpetrator is currently being held at the jail. But I don't know what's next. On site at the Family Support Center is the Thurston County Prosecuting Attorney's Office, the entire felony domestic violence team. Kim, Jennifer, Michelle, the whole gang is there. While I'm also getting help with housing, my advocate can work with the prosecutor's office to answer my questions and concerns. They will meet with me in a comfortable living room area where I feel safe, where my child can be rocked in a rocking chair while I feed her, and where I already am. You mean I don't have to go somewhere else? No. Foam finger from Washington State Coalition Against Domestic Violence as an award that I don't have to go somewhere else to tell my story. I also might have to make a follow-up police report and actually need to make a report for an incident that happened in Tumwater and Lacey. The Thurston County Sheriff's Office has a detective on site every Tuesday, and they will take a courtesy report for any jurisdiction. I don't have to tell my story 5 times. My advocates actually have personal cell phone numbers with lieutenants in the sheriff's department so that if I need help and they have questions, they will immediately get the answers that I need. I don't have to go to 5 different police stations. The Family Support Center has a partnership with the City of Lacey and employs the victim advocate who handles all of the misdemeanor domestic violence cases on site. She can meet with me on site and help me understand the status of my misdemeanor case. I can file a police report, get help with a protection order, get clothes for my child, and not have to go all over the place. I also want to remind you that all along, I've been given choices. Remember those menus? If I didn't want something, if I didn't want to get a protection order, or I didn't want to file a police report, I didn't have to. Oh yeah, my perpetrator broke my cell phone last night. I have no way to call 911, and I have no way to tell my family it's okay. But wait, the Family Support Center has a cell phone for me thanks to the Verizon Hope Line program. But what I do want is some early learning opportunities for my baby. How's she doing okay, Shelley? Great. On site at the Family Support Center is an early learning classroom that the Child Care Action Council utilizes every week for a kaleidoscope play and learn group. It's free, and I can go with my child on a drop-in basis. They also have a drop-in breastfeeding group with the South Sound Breastfeeding Network. Baby Wearers International has playdates on site and will show you how to correctly use slings and front backs and give them to you. And there are tons of opportunities to support my child's growth and development. I'm sure you're all familiar with the Adverse Childhood Experiences study, which was just talked about. Witnessing domestic violence is one of the most harmful experiences for children and has long-term negative health impacts. One of the coolest opportunities our community has had, which mitigates the negative impacts of domestic violence, is Camp Hope. The Family Support Center, with the help of many community partners, this past August launched our state's first camping and mentoring program that is proven to increase the hope in children who attend. Commissioners, did you hear that? That Camp Hope is proven to increase the hope in kids. Got it. Thank you. And you know what? The early results from the Family Support Center's work is that, in fact, hope was increased in the campers who attended. They're looking at the hope scales currently, and kids are leaving with higher hope than when they went to camp. When little Layla gets older, she too can attend Camp Hope. So protection order, check. Police reports, got it. Basic need items, including housing, got it. Given options, absolutely. Early learning, yes. Is anyone else exhausted? Does anyone else feel like what just happened here? So hi, I'm Natalie Scofrin, and I'm the Deputy Director of the Family Support Center of South Sound. And I appreciate you going on that journey with me and laughing, and I think we found some jokes. But what you just experienced is our everyday. This skit reflects the awesome, tough, dedicated that not only my staff does, but our community partners do every single day. And we do this not in just the month of October for Domestic Violence Awareness Month, but we do this every single day. So Abby, our Family Justice Center Program Manager, has been passing around links. And if everyone on this side of the room and commissioners, if you can start connect all of your links with one another. And connect yours with Commissioner Blake's.
There we go. You got it? I got it. There you go.
Ian?
There you go.
You're allowed to move with your links if you want. You don't have to stay stagnant.
What are we doing?
So that's a lot of links. That's a lot of connections. We are all links, and we are all a part of our community's response to domestic violence. So thank you. You're welcome to sit while I finish, and someone can be the link holder. And yes, the Family Justice Center is a national and international best practice. It is proven to increase offender accountability and victim and survivor participation in the criminal justice process. Yes, we as the Family Support Center and as a community have been honored and blessed to receive 2 huge U.S. Department of Justice grants to support our project. But we do not do this alone, as you see with the links. The Family Justice Center is collaborative and includes leadership partners from the prosecutor's office, the clerk's office, the sheriff's office, and about a dozen other memorandum of understanding partners that we work with regularly. The 4 leadership partners work alongside many of you in this room and who are committed to serving survivors. And as I've said, every day our team sees survivors who are begging for safety, who are begging for housing, who are in need of clothes for their children because they just left their home and all they have are the clothes on their back. They need food, they need a new cell phone, and they need their questions answered. And they need hope, and we provide hope. I could go on and on about the amazing work of all of our partners. It's tough work, it is, but it's also really rewarding. The skit I just did may feel like a lot, and it may have felt kind of trivial, but this is the reality. And it's what our survivors are handling every single day. And they're resilient, they're strong, and they're able to move onto a place of safety and stability with the help of the Family Justice Center and all of our partners. So thank you for your time and for your ability to go along that crazy ride with me and for acknowledging October as Domestic Violence Action Month. So thank you.
We got tons of questions.
I'm sure. I'm ready. I'll clean up the mess, I promise.
No. We got that. Yeah.
Now, do you make referrals like to the visiting nurse program and those kind of things?
Yes.
Do follow-up?
Yep, absolutely. We make regular referrals to the Nurse Family Partnership and to our staff and our advocates really sit down with families and work from a strengths perspective of, okay, what's going on and what do you need? And follow the lead of the family, but then also know that we have a menu of other community partners who can also really build on what your family needs and strengthen that. So, absolutely.
Well, thanks for everything that you do down there.
Absolutely.
Thank you.
You bet. No comment?
I didn't think this was trivial at all, but it was fun because I'm sitting here nice and safe and warm. I know what I did this morning and this afternoon. I know what I'm doing tonight, what I'm doing tomorrow. I can't imagine someone being in that position so overwhelmed, not knowing what they're going to be doing in an hour.
Mm-hmm.
And they still have to take care of, your Abigail. What's the baby's name?
Layla.
Oh, Layla, yeah.
You gotta know their name, man.
Not knowing what they're going to do next.
Yeah.
And not knowing what they don't know.
Yep.
That is overwhelming. So this is not trivial at all. No, it's not missed on me. Thank you.
Every day?
Monday through Friday. Our office is open Monday through Friday, 9 to 5. And then we obviously operate Pear Blossom Place, which is not a confidential domestic violence shelter, but we do from time to time get calls on the weekends. And we partner all the time with Safe Place. They have an amazing confidential shelter, and they have that 24-hour hotline, so we will easily call them and say, hey, it's a Saturday, and my volunteer might not know how to respond, but we've got those connections so that we can respond when needed.
Wow, that's incredible. I don't know how y'all do it, and while y'all being Southern, sorry, you guys do it in the sense of every day. How long have you been doing it, Natalie?
So I worked, yep. I've been in the domestic violence field, I say just about 10 years.
But at Family Support Center?
I've been at Family Support Center, has been involved in the Family Justice Center since about 2011, 2012.
So how many years for you?
For me,
yes.
At Family Support Center,
yeah.
4.5 years.
4.5 years. And Trish, how many years for you?
That's a great question. I might have to pull my personnel file.
No.
It's between 16 and 18.
Yeah.
Wow.
Wow. And then I know she's going to get on to me, but Shelley, how many years were you there before you?
13.
13 years. Look at that right there as far as a team, and Abigail and all the other members of Family Support Center. What a critical asset we have here in Thurston County. Y'all are the heroes of Thurston County, taking care of families. We all know families are the nucleus of keeping the community together, and you do it on the front line every day, every minute, every hour. And I do not know if I have words to express my thanks and gratitude for all y'all. Even when Shelley was there and y'all taking charge of it now, it's just taken off and has on a great glide path and absolutely marvelous. So thank you so much.
Thank you, and I'd just like to acknowledge that the Family Support Center obviously has not done this alone, and our 4 core partners of our Family Justice Center, the Thurston County Prosecuting Attorney's Office, led by John Thunheim, Sheriff Snaza, and the Sheriff's Department, as well as Linda Enlow and her team at the County Clerk's Office, have been great core leadership partners. Mm-hmm. And while we have the pleasure and sometimes the trauma of working with these survivors every single day in the community-based capacity, it wouldn't be a Family Justice Center without those partners and without the opportunity to walk that survivor through all of the components that they need to be healthy and safe. So thank you to our partners.
You bet. Thank you. Leave it there. Just leave it there. Just leave the mess right there. Yeah, we're going to. Yeah, this is home now.
We stand in your shadow.
Yeah, we like messes. We make them ourselves. Yeah, okay. Thank you. The next item we have on the agenda is a departmental item, and it's a public hearing. I think I'm going to jump, though. I'm going to jump around for a sec and go to Thurston Mason Behavioral Health Organization and ask Mark Freeman to come up. Is he out there, or did I jump around too fast? Yeah, yeah. That way we'll get the slideshow out of the way, and then we'll do the...
7? 8, 7? Yeah, Mark Freeman.
Yeah, I got it. And then we'll do the public hearing announcement. So, Mark, you're up next. Yep.
Oh, he's not dancing.
No.
No motion.
That's all right.
So, good evening, Commissioners.
Good evening.
Tell us who you are and where you're from.
Good evening. My name is Mark Friedman, Thurston Mason, BHO, Behavioral Health Organization.
Yeah.
And I am before the Board of Health today to basically do a status update on the BHO in particular 2 areas. One, with what involvement and what crossover do we have in terms of services with law enforcement, and the other one to do kind of a legislative update or preparation for the upcoming legislative session. So, all right, now I have to figure that out.
There you go.
Is that large enough?
It's the only one we're going to get, so go ahead.
That's true. We have a number of programs. We being the BHO funds a number of programs with our provider agencies throughout both Thurston and Mason County. In particular, the couple I want to talk about today is one, the Thurston triage facility, a relatively new add to our service array, and our mobile outreach team. Thurston facility has been running now for over a year. And the data I want to show, first place, the service provider for Thurston triage facility is Telecare, a new provider to our region. And this past year in the operation, we have served over 274 missions from police. 85 of those were involuntary services, and 189 were voluntary services. But these are all direct police referrals. We have a lot more work to do in terms of making this facility operational, particularly around how do we take direct referrals from the jail of individuals who have been incarcerated. And these are things that I'm working on with actually what is a very cooperative group of individuals cross systems here in Thurston County that's remarkable when you look at some of the history. And that involves the jail, Thurston County Sheriff's Jail and Jail Manager Todd Toma, the Prosecuting Attorney's Office with Joe Wheeler, and Defense Counsel with Patrick O'Connor. And then a number of the other law enforcement agencies have been involved. Both Sheriff and Lacey have been actively involved in trying to set up a program where we can effectively divert individuals who police encounter due to either some activity of theirs on the street or, in fact, having committed a crime, looking to not have the jail be serving as a large psychiatric facility, but instead to divert these individuals to a better chance to recover and therefore not remain in the law enforcement system of care. Maybe care is not quite the right word, but we'll go with that. So that's 274 individuals that you could consider would have been brought to the jail that were not. That's a pretty significant impact in the time period from October 2016 to 2017. The mobile outreach team is a new program that has been operating a short period of time, and again, that's came to being as same players across system in looking at how do we assist police on the street and do more crisis outreach. Included as a subset of that is the LEAD program, Law Enforcement Assisted Diversion, which really is just getting off the ground now, thanks to, again, all the players that are mentioned. Here in Thurston, the beginning with the mobile team, we've served 39 individuals for basically a 3-4 month period of time. In Mason County, we have a similar team operating as well, and we have served 48 unduplicated individuals. These are individuals that the police contacted the mobile outreach team to come engage, and so the police can hand them off and not remain involved. Overall, when we look at the involvement for all the BHO services, the outpatient services and the full range, we're talking for 2017 up to basically current, we have served over, or had law enforcement referrals, the amount of 1,333. So in terms of having an impact in the community on individuals tied to law enforcement, that's a pretty significant number of individuals. We serve an average probably around, I'll say because it's there between people enrolled in services and just crisis, but we can get up to about 9,000 individuals a year that we serve in total.
Can you go to your legislative slide?
Yes. Mm-hmm. The purpose of the legislative side is to
You gotta click it. Yep.
I was taking it, unfortunately literal. Yeah, I moved to my slide.
You
I'm
did,
good.
but I want to see it.
Sorry.
There you go.
The upcoming session, there are a number of issues that the behavioral health organizations are facing with regard to the change in policy by the legislature and by the departments to integrate mental health, actually behavioral health, with primary care. In particular, the integration is moving the funding and management of Medicaid services, where right now behavioral health organizations, counties are carved out for that funding. Come the year 2020, it'll be integrated. There will be no carve out, and Medicaid funding will go directly to the managed care organizations to contract and work directly with healthcare authority. Huge change in the system. We have been working with the state, particularly the governor's office, to continue to try to identify the problems and issues with this full integration. Not so much the financial part in legislation, that's a done deal, but more on the clinical side of how it operates and what remains the involvement of local county in the direction and basically trying to help manage service levels for Medicaid services to our population. So the numbers that I've just mentioned, including like the 9,000 individuals, that would not be in our control come 2020 if things stay on the path that's going on right now. So there are 3 key points of what we're trying to do and change and offer to the legislature to put into statute, and in part almost got into statute this past year. There was a bill that was almost passed past year, 1388, that would have addressed and directed healthcare authority to accept that there would be leadership tables in the BHO regions that would really set up the plan for delivery of service in the regions. The leadership tables would include county and managed care organizations, BHO. Unfortunately, that bill was not passed. So one of the key pieces we are working on, and so far actually in discussion with the governor's office, there's a lot of positive support for basically putting into statute the creation of these leadership tables. So that is the kind of the next step, and that I will be working with the BHO board about, is how to do the actual next steps and begin even now without the legislation to create these leadership tables and work directly with the managed care organizations for planning for 2020. The other issue is, as again 2020 comes around, the plan that the ledge has is for the counties and what was the behavioral health organizations to continue to work with the non-Medicaid population, which basically means focusing on crisis work. But even with that, there is no plan to help set up the funding for trying to make this happen. While we might receive operational funding, it will be after the fact, and we need funding upright because the ledge, when we hit 2020, will sweep all the BHO's reserves, and we won't have that kind of cash flow to help manage our system. So we're asking to work with the legislature and healthcare authority on about how do we go about standing up a program that they're saying we can and request to do so without that kind of planning around funding. Third one is there has been, unfortunately, multiple signals coming from healthcare authority regarding the ability for managed care organizations to delegate any of their contracted responsibilities that they will have come 2020 to what are now essentially the BHOs for the services that we're currently doing. So sometimes some messages that yes, there is a provision where the managed care organizations can contract with us and allow us to keep doing some of the services we're doing now, such as some of the diversion work that we're doing in the community, or the partnering and what we're doing with other cross systems to try to deliver the best care we can in these communities. So probably the key piece we're asking for, and again, for the governor's office to support with the legislature, is have it in statute and have it clear that the managed care organizations can delegate responsibility to the behavioral health organizations, certainly within what's allowed by federal statute. Those are the 3 key pieces that we're going to be talking more about and working on as we move into the upcoming ledge session.
Any questions for Mark?
No, I don't know enough about it to ask a real good question. It's pretty darn complicated. And it worries me that you're going to run out of funding here before too long. I mean in a few years.
No, there will be funding for the operation. It's the question of being able to stand up the organization and have the state basically recognize this just doesn't happen magically. So that is a concern.
I hope we made the right move when we split this up.
Well, one way or the other has to be stood up by us or somebody else. So this is going to remain a problem one way or the other for whomever.
Hey, Mark, going back to the law enforcement utilization data, the previous slide.
Yes, sir.
I just have a couple quick questions. I know you're going to know this off the top of your head.
I'll make it up.
Shows at the very top, 274 total admission police referrals. Does that mean the next 2 85 invols and 189 voluntary were not as a result of police. They're DMHP or walk-ins. Do we accept walk-ins at the triage?
Actually, those are subsets of the 274.
They are a subset.
So right now, the triage facility is only taking people that have had police contact.
Okay.
The focus has been, it took us a while to stand up the involuntary court. Focus has been on voluntary referrals. We are moving towards shifting that focus as we have the court in practice now to pick up more involuntary, which would include also more individuals in the jail who are displaying psychotic behavior and really should be in a hospital or a psychiatric hospital and not in jail.
Okay, 2 more questions. They're dead easy. The law enforcement referral, does that include corrections, people coming from corrections into the facility? Is that considered a law enforcement referral?
Yes. So one of the interesting things, today even, there was a meeting on the oversight of the LEAD program, and we were discussing, even for the mobile outreach team, who else or where else should we be looking for referrals that may not have been active in terms of it. And one of the key folks identified was State Patrol, because apparently there's a fair amount of activity on state-owned property that State Patrol becomes involved with. The easy site was how many people trying to get to the governor's office, and to have those individuals be referred into the system and not whatever else happens in the correction system. So yes, we're looking and to even expand and make sure other entities are involved. We're talking with Yelm, we're talking with Evergreen, Evergreen
State
College Police, and also with the tribes, the 5 different tribes we're involved with between Thurston and Mason County.
But it's not just a cop referral on the street, it's coming from corrections as well.
Yes.
Okay.
Basically, it's coming from law enforcement where we can divert somebody going into a jail in the system.
And finally, the mobile outreach team, you have 39 unduplicated referrals.
Mm-hmm.
Any clue or just kind of a shoot from the hip if you want to, how many are duplicated? Would it be double?
Probably not quite double. I would throw on maybe about another 50. So I would bump that up to probably around 50 individuals.
Repeat customers?
Yeah.
Okay.
We do have some repeat. But just to be clear, with individuals that the mobile outreach team are picking up, there have been no incidences where they've come to their offices in Olympia and then just released where the doors open and they're sent out on the street. They've been engaged where they've been worked with to try to find them where they're going to stay, and more important, well, I'm going to say more importantly, but definitely how to hook them up in treatment so it continues on after that initial engagement.
Well, I'm glad you said that. I know that, but people listening that don't know that now do. Thank you.
Yeah. Well, the purpose of the mobile outreach team really behind it is an intensive case management team to do the handoff. Mobile does the initial engagement and then hands them to other clinicians to continue working to engage them, which also includes for medication until we can hook them up with ongoing outpatient treatment.
Okay. Thank you, sir.
I have no questions. Yeah.
I got it.
Okay. Thank you so much, Mark.
Thank you.
Mm-hmm. So now I'm going to ask Art Story to come and give us a little bit of background on the setting a public hearing to amend Article 4 of the Thurston County Sanitary Code. Art, give us your best brief description of this.
Okay. Good afternoon. I'm Art Starry. I'm the Environmental Health Division Director for Thurston County Public Health and Social Services. And as Commissioner Blake said, we're here today to ask you to set a public hearing to make amendments to the sanitary code, the septic system regulations, which is Article 4 of the sanitary code, and to reenact or extend the Henderson Watershed Protection Area program. So as you know, on September 12th, the county commissioners adopted an ordinance that reenacts the Henderson program. It set in place some rates and charges that will help fund the program, and it extended that portion of the program for another 10 years. To complement that, though, there's some changes to the sanitary code that are necessary to continue the program. And so what the ordinance that we're hoping that you'll schedule a hearing for in November will do is do 3 main things. It would extend the program for another 10 years so that it would expire on December 31st, 2027. If you don't do that, at least the health portion goes away at the end of this year. It changes the frequency for the dye trace of dye tracing of high-risk septic systems. So it'll change that over a period of time from going once every 6 years to once every 9 years. We've reviewed data, and we think that the evidence supports the change in the frequency. It'll still protect public health, but it'll reduce the amount of effort that it takes for staff, and it'll reduce the burden on septic system owners out in the area, so we think it makes sense. And the last thing is that it would actually change some requirements for reinstating septic systems that have operational certificates that have expired or that have become non-conforming, and that's the septic system regulation term for someone who hasn't followed through with the regular monitoring and maintenance. And so we're trying to actually reduce the burden on the homeowners or the septic system owners. The things that are in place now aren't working very well. We actually think they're a disincentive, and so we think that by making these changes, it'll actually help the program go along. So in a nutshell, those are the three things that we're asking you to consider, or that we're asking for public comment on, and that we hope that you'll set a hearing for following the Board of Health meeting in November, which is on November 14th. And so I don't know if you asked me to be brief, and that's about as quick as I can be.
Yep, that's great. But at this point, we're not going to make any changes to any of that regulatory stuff until after we have the hearing. Is that
No, right. This is just, right now, we're asking you to set the date for the hearing. If you schedule a hearing, all the proposed ordinance will be put online and made available to the public, and then they can make comments to us or to you, and or they can show up at the hearing and let us know what they think. And then, depending on what you decide, that'll determine the fate of that program.
Yep. Any questions?
Nope.
Okay. Is there a motion?
I move to set a public hearing on November 14, 2017 at 5:30 p.m. or as soon thereafter as the matter may be heard at the Thurston County Courthouse, Building Number 1, Room 280, to receive testimony on a proposed ordinance. Will amend Article 4 of the Thurston County Sanitary Code, the regulations governing on-site sewage systems, and extend the designation of the Henderson Watershed Project Protection Area.
Second.
It's been moved and seconded as stated. All those in favor say aye.
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 Aye, and that motion carries. All right.
Thank you
so much. Now I'm going to turn to the Director of Public Health and Social Services to hear her report.
Thank you. In the interest of time, I'm going to defer my report to next month and give our health officer, Dr. Wood, a chance to share an update on infectious diseases. But I would also just like to say I really appreciate the investment that the Board of Health made in dedicating so much time to all the important issues that were discussed here today, and thank all the presenters and partners that were here and for the lovely skit that was done. So thank you so much. And one final thing that I don't think was covered earlier is the phone number for people who might need to get help for domestic violence. And the Safe Place hotline is 360-754-6300, and that is answered by an advocate 24 hours a day. The Family Justice Center can be reached at 360-754-9297, Monday through Friday from 9 to 5. So thank you again, and I'll turn it over to Dr. Wood.
Hello. Is this working?
It is working.
Okay. I would like to just make a plea that people pay attention to the fact that we are all indoors more than we were this summer. School's back in session. We are seeing a lot of vaccine preventable diseases. And the comment I want to make is that we all want the best things for our children. So there are many tools in our toolbox to keep us all healthy and well. I'm talking about whooping cough. I'm talking about mumps. I'm talking about influenza. And please, if you're ill, stay home. Wash your hands. Cover your cough. And I urge you to get appropriate vaccinations for these vaccine preventable diseases. Thank you.
Great. Any questions, comments for the doctor?
No, doctor. No, thank you.
Thank you. Or anything? Nope. All right. Is there a motion to adjourn?
Mr. Chair, I move to adjourn the Board of Health meeting of October 10, 2017.
Second.
It's been moved and seconded to adjourn the Board of Health meeting for October 10th, 2017. All those in favor say aye.
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 Aye, and we are adjourned.